Hi, everyone. Welcome to another episode of the Patient from Hell podcast. It is my complete honor and honestly very excited for this episode because I get to welcome an oncologist, but also hopefully someone I call a friend to this episode. This is Dr. Chris Terry, who has been with Manta Cares, supporting us, cheering us on for in over a year and a half now. So with that very vague introduction, I'm going to ask Dr. Terry to talk about one, how he got into oncology, and two, how he found us. So that is a fun story in and of itself.
Yeah, awesome. Thank you so much for having me. I'm really, really excited to be on this platform and thankful to be on the platform. Um, and like you said, I would definitely call us friends, by the way. And we are like that type of friend who you don't talk for a little while and you're like, oh, I'm thinking about Samira, and then you get in touch and it's like instant reconnection and we're on the same wavelength and everything. So it's a pretty special kind of friendship. Yeah, I think I'm so glad to be part of this because I've been a big fan of what you're doing from the beginning, like you said. And so thank you for having me on. In terms of like my story and how I got into oncology, I I think as a young kid, I always wanted to help people or make a difference in the world. That was kind of instilled to me at a young age from my family, just by the example that they set, kind of the values that we had. And when I was kind of thinking of ways to do that, like being a doctor sounded like a pretty cool way to do it. And you feel good when you help people. I know there's something that's, I guess, inherently selfish about that, but it's the truth at the same time. Like when you're helping others, you feel good about it. So it's reciprocated.
Mm-hmm.
And so I kind of set on a path to become a doctor at a pretty young age, despite the fact that no one in my family is in the medical field. So it's been kind of an interesting experience in terms of like being an undergrad and then having some of my peers be like, I got to study for the MCATs. And I was like, what are the MCATs? And then it's, there's 4 years of med school before you get to choose what you want to do. So all of that was totally new and foreign to me. And I just kind of have been going along with it throughout that time. And so went to medical school. I thought I would maybe do like orthopedic surgery when I first went into it because I love sports, and we'll talk a little bit about that later, I'm hoping. Um, but ultimately didn't feel like that was the best fit for me, and I kept just kind of gravitating towards people that I really respected and liked, and I would kind of try and follow in their shoes and be like, hey, I want to do what they're doing at some point. I want to hang around them and take care of people the way that they are taking care of people. So I did a med peds fellow or a residency program, which is a combined program where you do internal medicine and pediatrics. And I loved the way that they communicated with patients. That was probably the primary reason I went into med peds. And then from there, from an oncology standpoint, something that's interesting is I think where I came from a very small town. As I mentioned, nobody in my family is in medicine, and I think, as many of your listeners probably know, the medical language is like a totally different language. Like I felt like I was learning a new language, right?
Mm-hmm.
Um, so something that somebody told me early on was there are two kinds of smart people in this world. There are smart people who make really simple things complicated to serve themselves. And then there are smart people who make really complicated things simple to serve others. And I loved that. And I felt like that's what I wanted to do from a medical perspective, is dumb things down to my level that I would need it at. And cancer oncology is such a complex world where people are really vulnerable, really kind of at their lowest point. And so I think it just brought everything together for me in terms of like, I can help people here. I can make a big difference. I can simplify what is just this crazy new experience for someone and make it more manageable. And so that's how I found my way into oncology eventually. It was kind of a whirlwind.
Can you talk about where you grew up?
Yeah, I grew up in central Pennsylvania, so about 40 minutes from Penn State University. That's how I usually explain it. And then if somebody's from Pennsylvania, I'll say Lock Haven University is the town that's closest to where I'm from. The actual town is called Beech Creek, so that in itself tells you that it's pretty rural. Um, but if you put like a tack in the middle of the state of Pennsylvania on a map, that's where I'm from. Very small
Wow.
town. Yeah,
Wow. How many doctors were in your town?
it's a good question. I did have a couple of I had two good friends growing up whose parents were physicians, family physicians, and I always had a ton of respect for them. And I actually ran into one of them relatively recently, and I shared that I think he was probably much more responsible for me going into medicine than I even realized, and I'm sure than he realized. Um, so yeah, there was like it's a small community-based hospital. Very few, or like there's few physicians there, but those who do practice medicine there, them, the community knows them, and they're important to the community and what they do for the community. So I do think that was probably important for me to see at a young age and want to aspire to.
So that actually leads us into one of the questions that we both were hoping to get into, right? Which is community oncology versus oncology in different settings. So can
Mm-hmm.
you talk a little bit about just definitionally what does community oncology mean? And then why you chose to end up in community oncology?
Yeah, definitely. Uh, and this is something that was foreign to me as I was going through this. But in general, I would say um, there's two main categories to break it down into. There's the academic big city names. So usually they're academic institutions or hospitals that are affiliated with academic centers, and they tend to be in bigger cities or more metropolitan areas. Although there are also community-based hospitals in the city as well, but they're usually not affiliated with an academic center. And this landscape is shifting and changing consistently, meaning many people have probably noticed that academic centers are now have their names seemingly everywhere. Um, and I think there's a lot of benefit to that. But there's also some drawbacks. I'm currently at a community-based hospital where it is literally our town, our community. We're not affiliated with any major academic centers. We take care of kind of our local population here, and that provides individuals an opportunity to get their care close to home. I think as medical professionals, it's easy for us to forget how important sometimes some of the logistical aspects of providing care are. And so from where I was from, if you wanted to get the thought was if you wanted to get a certain level of cancer care or treatment, you would have to travel a pretty far distance, and you'd have to go to the cities and what I came to learn or recognize very quickly is things like driving an hour or even further to a facility, finding parking, paying for parking, finding out where you're going to stay, where you're going to go eat afterwards. Like all of those things add additional stress and challenges to the care that you're receiving, which is already stressful, right? So I always thought I would practice at an academic center when I was done training. I think that's kind of ingrained into you as you go through training, to be honest. I think you're just so used to it. You're used to learning from other people that are practicing in that setting. You have a lot of additional resources, quite frankly. And so you get used to that, and then you don't really think about practicing in a community-based setting. When I was looking for a job for a number of different reasons, was kind of all over the map. And I was initially planning on doing academic medicine, and then an opportunity came up for me to practice at a small community-based hospital, and it kind of, no pun intended, but hit home for me. And it was like it just felt like a good fit. In addition, I had like amazing mentors that I had actually worked with during my training here already. And so it almost set that example of like, you can get really good quality care close to home. There are differences. We don't do clinical trials and things like that, but I think it's important for people to be able to get their care even at a local community hospital if it's possible. And there's now a lot more collaboration between community-based hospitals and academic centers. Even though we're not affiliated with one, I feel so supported by the doctors at Boston, at Rhode Island, and I can call them and we can work together. And I think that's also something that's probably changed in some of the way that oncologists work together.
I love that example. And just if you're okay with it, sharing a bit of like my journey, because I started out with an academic medical center. I did most of my active treatment there. And then actually ended up finding the need to switch to another oncologist who happened to be at a community center. And I do find myself driving an hour. My community hospital is not close to me. It is an hour away. And the logistics, they definitely add up, even as a survivor. I am not in active treatment, but my iron levels tanked. So I've had to go in for iron infusions. So going back to the infusion center at a community hospital, it's just been such a different experience for me in a very good way. This is actually, I've been very pleasantly surprised and happy and feel warm and fuzzy because it's smaller and I've gotten to know everyone really quickly. Whereas at the academic medical center, I went in every other week for 2 years and still didn't know everyone. And here, like 2 infusion cycles in, and I'm like, yup, know all the nurses,
Yeah,
know all the docs, know all the reception staff. Like I know everyone, and it's actually very. I find it to be enriching in a very different way. So, for what it's worth, it's definitely worth the hour drive for me, and I can do it right now. So
and I'm so glad you shared that because I think you touched on a couple of important things. There are definitely differences between a big academic center and a local community hospital, and both good and bad. I mean, like you said, I do think there is something unique about having that. As much as you can try at a larger center, the personal touch can, when you're taking care of so many people the way that they do, it's not as intimate, I guess. Even though I'm sure that a lot of the providers are able to form great relationships, it's just a different setting. So that's certainly one component of it. And then at the same time, there are definitely services that we can't offer here that I know patients will get better care or need to go to a academic center for. And so I'm more than happy, or like I refer them, I tell them to go elsewhere to get certain types of care. And so I do think that there's a place for us to continue to collaborate. Like you said, survivorship. I've inherited several patients who have gone through their treatment at an academic center, but they live in our town, and they're like, I need my occasional scan. I need to see an oncologist who's going to be able to listen to me or go over some things. And we make it work. And I'm still in communication with the doctor up at the academic center. So I'm glad that you found somewhere closer to home that's working for you that way.
I don't know if it's close to home, but
it's still an hour. That's still, quite the trek.
It's quite the trek. I just, I can't give you a good reason for me not switching care. I think I just like it. It feels, I think there's something about the feeling of it. And it's not rational. It just it's a feeling. It's like, okay, this feels.
Your feelings matter, Samira. As your friend, your feelings matter.
Thank you. Thank you. You kind of forget that sometimes, right? On the oncology side, it's actually something that I don't know if you see with your patients. It's so easy to put the emotional side aside and deal with the kind of practical or the physical and forget the emotional side of it. But
I mean, 100%. And I think that comes back to even just the simple things like, I can't tell you how many patients talk to me about parking. Like sometimes when I see patients and I say, if you want a clinical trial, I'd recommend that you maybe go north or go south and go to some of these bigger institutions. And they say, but doc, how am I going to find parking there? And I'm just like, hey, you know what? Sometimes it's the little things. But it's true. It's true. Like, we get we get tunnel vision on, okay, this is the chemotherapy regimen that this patient needs, and in all fairness, that's our job, that's what we studied, that's what we went to school for, but it's so much bigger than that, so much bigger than that. And so whether that means the community setting, whether that means us touching base on mental health, physical health, whatever it may be, it's important for everyone to take a step back at times and kind of see the bigger picture.
I want us to transition to a different topic, but before I do that, I need to share a parking story because
Yes,
I just need to. This
everyone's
needs to
got one, so
It's
let's
totally
hear
true.
it.
So at the academic medical center, the individual I saw the most was the person who took care of the parking. I am not even joking. By the end of treatment, he and I were best buddies.
Yeah, perfect.
Best buddies. Every time he would show up, he'd like give me a high five. He'd like, I shouldn't say this publicly, but he would give me free parking.
Oh, I
He'd
was
be
gonna say you had to have gotten a couple of free parking sessions, or at least like a nice spot, right?
definitely all the time. And the thing is, I wasn't even trying. It was just I was getting treated during COVID, so my family wouldn't come with me. So the fact that he would take the 2 minutes to have a conversation with me while I would like enter and leave mattered. Like, I cannot tell you how much it mattered. It mattered to me so much. And I think because we reciprocated it, I got to know his family, why he became a parking attendant, how he ended up in the US. It was one of the most special relationships where when it ended, I remember bawling because I wouldn't see him as often.
Isn't
Like,
that crazy? Like you're the parking situation, but it just, again, it just really makes that idea that it's more than the treatment. It's the whole experience, that
yes.
you never know what's going to stick with you or land with you and carry forward with you. So that's so cool. I hope that parking attendant knows how much of an impact they made on your life. I bet you, I'm not sure if they do or not, but it's
They
pretty
do.
cool.
No, they
Good.
definitely do. Because I ended up, he had told me he had a blank space on his wall, so I ended up making a painting for him. So he definitely knows
Oh, that's awesome.
how much he meant to me in my treatment. So
Very
he's
cool.
it's been a minute. On that kind of arbitrary random note, I'd actually love for us to sort of go into your passion. So oncology, of course, but you've also had this oncology, let's call it oncology plus passion, and I see it on the wall behind you. So I'd love for you to like jump into why that matters, why you ended up doing that project as well, in addition to all the work you do in the sort of like clinical space.
Yeah. I think it's funny that you said that, because when we started talking about the parking attendant, I was like, this fits with what I'm passionate about, which what Samir is alluding to is I have a sign behind me that says Athletes Fighting Cancer. And Athletes Fighting Cancer is an organization that I've helped grow with the influence of patients that I've met. And it's all about using kind of the power of sport in the fight against cancer. And it really it developed from my passion with sports at a really young age. I talked a lot about where I grew up already, but I have 3 brothers and a sister, and we all played sports and were very competitive growing up, and we just loved it. And not only did we beat each other up a lot and, probably hurt each other too much for my mom's liking, but I think through those experiences, we developed a lot of kind of intangible tools. You develop some resiliency, some mental toughness. Obviously, there's physical benefits to being physically active, but the things that I carry most with me currently are, the friendships and the relationships that I had in the team that I was always part of, and I think that's so invaluable. And so when you talk about the parking attendant, I just think he's such a important part of your care team, and we don't
Yes.
keep that in perspective enough, I think.
Yes.
And so the way that Athletes Fighting Cancer developed was I was taking care of a young patient who was also an athlete. He had gone to college and was diagnosed during his preseason physical with cancer, and I was meeting him for the first time, and we had this kind of common bond of a love and passion for sports. It was something that he had kind of built his identity around, really. It was a huge part of his life. And all of a sudden, he's questioning, will he ever be able to do that again? He doesn't really feel as part of the team like he used to. He's a little more isolated. And he asked me like kind of what he could expect moving forward in terms of will he be able to play again? When will he get back to doing it? Will he do it at the level that he was at? And I didn't have any answers for him as a medical professional. So we started Googling. And as soon as you Google athletes with cancer, well, now you may find athletes fighting cancer. So that wasn't an intentional plug, but I just did it. But if you do Google athletes with cancer, it's pretty remarkable how many like famous, well-known athletes have had cancer at some point and then returned to their level of competitiveness, or at least used the skills and the experiences they had from their athletic experience in their cancer journey. And they talk about how it helped them. Yeah. And so we kind of felt like, man, there's something to this. Can we connect people who love to be physically active, who do find sport and teamwork and the coaching aspect? Can we incorporate that into their cancer journey, into the cancer experience? And can that help them? And so Athletes Fighting Cancer really has started as a, like I said, a patient-centered movement where I'm just trying to connect other athletes across the country who receive this difficult diagnosis and are looking to connect with other people.
That's awesome. I've always loved what you do, and I don't know if I identify as an athlete, definitely not at the level you take care of athletes on, but I think the spirit of it definitely resonates. Because I do think that there's a lot there, right? So I'd love for you to talk about some of these things. So you mentioned coaching, you mentioned in Taekwondo, I do martial arts, and there's a Korean word called junshi, which means fighting spirit, which I think for all of the battle language and oncology, it definitely translates. But I'd love for you to talk about some of these sort of insights and learnings that you've seen help people go from being an athlete without cancer to an athlete fighting cancer.
Yes, definitely. So I want to just touch base on like the language that you brought up, because it's so important. It comes up all the time. And I know that it's been talked about on your show before, but I also just like want to acknowledge, I was very uncomfortable with the idea of naming this group Athletes Fighting Cancer, but it was chosen by the people who had kind of helped found it. And I think that the idea of fighting, battle, everything's, language is different for everybody. But I think what we felt as we were developing this is that people can fight in different ways. People can be athletes in different ways. So we always, like, the idea of Athletes Fighting Cancer was initially developed to really support people who, like you said, were kind of high competitive athletes, very small niche, an individual group of people, but there's certainly a broader concept to it and a trickle-down effect that we hoped would happen, and we hoped would inspire other people to find their inner athlete, is the way that we put it. And that can be in so many ways. It can be yoga, it can be going for a walk. It's really just activating your mind and body, is what we say. You need to activate your mind and body the best that you can, and you'll see subtle improvements from there. You'll see that your mental health is better. There's lots of studies that have shown that people who are physically active improve their mental health, their quality of life, and improve sleep. It improves bone strength. And now there's more and more research saying that it plays a role in cancer prevention, treatment, survivorship. So that world of exercise oncology is really exploding. But what we do specifically with Athletes Fighting Cancer is, again, connect that one-to-one, kind of give individuals a sense of belonging to a new team, a very unique team. And so surrounding them with teammates, we are able to connect people with coaches so that they can help guide them through physical activity and exercises. There are online programs that provide a lot of the exercise instruction as well. We work with a lot of these researchers in exercise oncology. to help clarify and bring tools to both patients but also healthcare providers about how to guide individuals in a safe way to incorporate physical activity. And so those are some of the key ways that we support and help people. And yeah, that's
Um, can I actually put your clinical hat on?
yeah.
And
Let's do it.
I'm gonna pretend as I'm a specific type of patient, okay? And I'd love for you to give me any guidance when it comes to exercise, because I think it's one of the areas of oncology where it's hard to get the right advice. And I put that in air quotes because there's a lot of information out there, but it's not easy to figure out what is applicable. So
Yeah.
if you're open to it, and yes, this podcast is not medical advice. What is being shared is not. Please talk to your doctor, and we have our caveats at the end of the show, but this is entirely hypothetical. So
It's all good. I feel very comfortable doing this. I think it's something that, unfortunately, like most oncologists don't feel comfortable enough doing, and understandably so. We don't get like a lot of training in it or anything. So I understand why some oncologists would have some reservations about giving advice like this. But in general, for anybody that I meet, I try to get a sense as to what they enjoy doing. So you were mentioning that you do martial arts, and I would say that's awesome. Keep doing martial. Let's say you're going through treatment. I would say that's awesome. I want you to keep doing martial arts as much as you can throughout treatment. I'm going to be keeping an eye on your blood work. I'm going to be keeping an eye on some of these other things that may limit your ability to participate in those things. And if I'm concerned, if I see that your red blood cells are too low, or your platelets are too low, or anything that I feel may make it unsafe for you to participate, I'll let you know. Um, I think it's also important to set expectations. So you may not be able to perform at the level that you are used to, and that's okay. You may need to take more of a break than you're used to, and that's okay also. You need to listen to your body. And while I'm going to encourage you to push yourself a little bit, I don't want you to push it too much. So I also encourage people to kind of listen to their body, find that balance, and understand that you can't always push your limits. There's a time and place to do it, a safe way to do it. But in general, if somebody's pretty active, I want them to keep doing that. If somebody's not active at all, then I recommend setting really small goals up front. So let's say you're going to get up and walk around the house 5 times today. That's it, just 5 times. Make sure you get up and you do a loop around your house 5 times. And then after you get done doing that 5 times, I want you to feel really good about yourself for completing that task. And then maybe the next day you're gonna grab 2 cans of soup out of the counter or out of the cabinet, and you're gonna walk around and you're gonna do some bicep curls while you walk around. So incremental changes with just things that are around your house. Setting small tasks, I think, small achievable goals to start is really important. And then you can build from there. You start to gain some confidence. You start to gain some strength. And it's kind of this ongoing building the success and feeling good about yourself, that self-esteem. The last thing that I would say is if you can try and connect with other people who are also trying to be physically active. So important. So I keep mentioning team. And while your healthcare team is important, your peers and your finding other people who have similar goals is also important. So there's nothing like accountability when it comes to exercising and stuff like that. Or, if somebody's training for a 5K, it's always helpful to have that other person who's training with you because you don't want to let them down. So I think that's a helpful thing to incorporate also.
One of the things I had set up, but then COVID happened, was I used to work as a consultant many years ago. And when I got diagnosed, I called up one of my mentors who has his own kind of cancer story. And I called him and I was like, hey, do you have any piece of advice for me? And he goes, yeah, think of this as a project and you're the project manager and you need to assign your team. And just remember that one person on your team has to be assigned to be accountable for you for exercise. So I had set up my like family and friends all showed up, and I was like, okay, you are my communications director, you are my exercise director. So I had a buddy of mine who was my exercise director, and we got 2 sessions in before COVID lockdown happened, and then well, COVID lockdown happened, so that went out the door. But the intent had been there
Yeah, yeah.
to set
And
it up.
that's the first part is that intent, getting things started. Um, that's awesome. And I've heard, like I said, I've heard on your podcast before people sharing their experience and people who were not physically active and then kind of found that as something that they could do. There's so much that you can't control throughout cancer, and and I want to acknowledge that sometimes if you are feeling really tired and exhausted from your treatments, maybe you can't be as active as you would like.
Right.
Um, but I think that if we all were honest with ourselves, we could probably do something a little bit better, be a little bit more active in some kind of way, in some kind of capacity. Um, I, I've talked about the mental wellness and resiliency part of it as well. That is such an important part of being an athlete. And so, meditation, mindfulness, to me, that's athleticism, because it's again activating your mind, it's training your mind and your body. There's inevitably a connection there. So you don't have to be moving around or running 5 miles. If you can do some deep breathing exercises and stuff, that to me is a huge step, and really important for you throughout your journey.
I really appreciate sharing all of that. I'm gonna switch tactics a little bit.
Yeah,
One of the things you and I have discussed in the past was, if I remember this right, when a patient shows up to your practice, never met this patient before, newly diagnosed, one of the things you do up front is a Cancer 101 mini lecture. I don't think you said it was a lecture, but you sort of walk through who is part of your care team, what does it mean, what are the disciplines at play. You kind of go almost through like a definitional, this is just the lay of the landscape. Am I remembering this right?
yeah, totally. And that's part of why I love what you do so much and what Manta Cares does. Like, is with that with the planner, it helps connect the provider and the patient if the provider is willing to engage in that process. And we've talked about this a lot. Like, I think up front, it's so important to kind of to make sure you're on the same page at the beginning. So whenever I meet a new patient, I want to make sure that they understand what their diagnosis is. So I'll actually say, like, so I have a whiteboard in all of my rooms, and I'll draw up, and I'll say, this is your diagnosis. And so, for example, renal cell carcinoma. Okay, I can say that and move on, but if a patient doesn't really understand that it's kidney cancer, it's not super helpful. So I'll always say the diagnosis in like how I refer to it, but then also kind of basic terms. So start that way, and then the next thing I do is talk about staging. And I always say, everybody's going to ask you about what stage are you? What stage are you? And it's difficult if you're the one with cancer and you don't really understand what stage you are or how they got that staging. So I say staging in general, and obviously it's different for the different types of cancers, but in general, I'll go through this like TNM, and I'll write it up on the board. So T represents the tumor size. N represents nodal invasion. So are there lymph nodes around the tumor that have been invaded? M stands for metastasis. So is there evidence of cancer that has traveled beyond to distant organs? That's what metastatic disease is. And based on those three criteria, typically that's how oncologists develop the stage or identify the stage. So I'll go through that with each patient. And then I'll say, based on what the staging is, that usually dictates what your treatment should be. And treatment can be very complicated. And I break it down into 3 teams: surgery, radiation, and medical oncology. And it's got to be very clear. These are 3 different healthcare teams. So you're going to be seeing potentially a surgeon if they can resect your tumor, or they can do something surgically to help you. So for example, for prostate cancer, that may be a urologist, which again, doesn't necessarily always say, oh, this is my surgeon, but urologist kind of fits in that surgery bucket. Then radiation, you may hear people say rad-onc, or are you getting radiation? That's another specialist. So that's another care team. And then medical oncology, which is what I am, we are the ones who give chemotherapy. We can give immunotherapy, which uses your immune system. We can give targeted therapy, which focuses on certain mutations that we may find in your tumors. So identifying those three different teams, and then even within those teams, I'm the medical oncologist, so I start to talk about the different treatments that you can have. And so I think it's just important to kind of set that general landscape up for the individual. One, because again, they'll get asked questions about it from their friends and family, which is another thing that I touch on. I say you'll always hear plenty of opinions and thoughts from your friends and family, and I think it's wonderful because it means they care about you, and I think there's a lot of value in it.
Yeah.
At the same time, everybody's experience is totally different. Everybody's cancer is unique, so try to keep that in perspective, and please talk to me about things that you're interested in or want to pursue. So that's the general initial conversation that I'll have with a patient, and then obviously we'll dive into questions and things like that.
I love that. I'm so glad we got you on video walking through that. I cannot tell you how happy I am we got you on video doing that.
Could have brought in a whiteboard. That's
I know. I was thinking that too. Next time we'll have a digital whiteboard.
All right, part 2.
Part 2. No, I'm so glad you did that because it's been one of the pieces that I think, I'm pretty sure it was our conversation. I think you pointed it out to me one of the times we spoke, and I was like, you know what? You're so right. But we don't do a cancer 101 ever. It happens, but it happens in a blip, and it usually happens in an appointment where, at least for me, I was like, wait a minute, what do I have again? What are you talking about? Hold on, what? Right? Yeah. It's happening in that like deer in headlights moment of the cancer experience. So I'm actually really, really happy we recorded this because I think that just that little snippet, I think is going to be of such immense value to have someone understand the kind of framework and logic at play. So thank you for doing that.
I'm glad you said that. I'm glad that you think it's helpful. But I'm also glad that you mentioned I also totally understand that although I'm trying to break it down simply, that most people who leave the office are probably, what the heck just happened? Even though I tried to, even though we took our time and went through that, I can't imagine what people are going through in that moment and what's racing through their mind. This is something that I'm doing multiple times a day. So it's different for me than it is for that individual who's going through it. And so I'll actually write it up on the whiteboard and then I'll tell them to take a picture with their phone as well. But I'll write it out and we can put it on the show notes and stuff, a link to it on the show notes.
That'd be awesome. Thank you. That'd be amazing. With that, I'm going to ask you a wrap-up question. I'm going to ask you, because you're relatively early in your oncology career, right? You hopefully have many decades ahead of you of helping thousands and thousands of patients. So if you look out 10, 20 years, what do you hope the field of oncology looks like?
Oh, that's an awesome question. I thought you were going to ask something like about me planning something, and I've learned that I just don't plan things anymore because I never get it right. I heard that planning is good, plans are silly. Like it's helpful to plan. It's helpful to do the act of planning, but setting plans and sticking to them are silly. So thank you for not asking me that because I'm not good at that. But I would love I think you and I are on the same page on this, where it's more of a dynamic relationship between patients and providers. And I will be the first to admit that providers could certainly do a better job of engaging patients and allowing patients to be part of the care. But I do think that there's responsibility on the patient's end as well to advocate for themselves. And I hope that the culture of oncology has been shifting a little bit more where patients feel comfortable doing that, where they feel comfortable and confident in doing that, and they don't feel like, and oncologists don't feel threatened by it. It's a challenge because unfortunately time is limited in appointments. I hate it, but it's the reality. And, to have those really meaningful conversations, I think, and really have a great relationship like that requires time. So if I could choose the way that the oncology field would look like in the future, first, I would hope that we have a cure for everything.
Right.
Secondly, I would hope for that relationship to be better and more collaborative, with not as many time constraints at least, and a more holistic approach. So I don't think it's realistic to expect an oncologist to cover everything from a holistic standpoint. I think they need to be in tune with it and aware of it. But I think everybody should have a care team where we're addressing all of the different needs, and it shouldn't even be a question. You shouldn't have to search for those resources or those team members. They should be provided to you once that diagnosis is made. So I think that's probably my biggest answer: is everybody who gets a diagnosis has a team who's able to help the individual on a very holistic, in a holistic way, and that the individual going through it feels empowered, feels safe, and ultimately feels like they're getting the best care possible.
Thank you for sharing that. We are definitely on the same page. Yep, you were totally right. Yes, of course we're on the same page. I love the vision of the future, and I am certain we're going to have a part 2 at some point. So thank you for joining us in this episode. Thank you for sharing your insights and the mission. And I hope that from this episode, everyone gets to take a little piece of the athlete and imbibe it into their lives.
Awesome. Thank you so much for having me. Thanks for everything you're doing. It's amazing.
Thank you, guys.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The content here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.